Let's talk more about the Zika virus. Yes. We hear about it, we read about it, it's on television. What is your professional opinion on it?
So Zika virus was first isolated in Uganda in 1947. It was, interestingly, it was isolated first from the Zika forest in Uganda. Most recently, we had a small outbreak of patients getting the Zika virus in French Polynesia back in 2014.
Why Brazil? How did that happen?
Yeah, so it turns out that later on in the year 2014, there was a canoe competition which actually happened in Brazil, and competitors from French Polynesia went over to Brazil to compete.
In a canoe?
No, they didn't go by canoe. There was a canoe competition over there.
Okay.
I'm not sure. It might be cheaper than flights. We will look into that option shortly after this interview. But they went over, and when the competitor went over, he was actually viremic, which means he had the Zika virus multiplying in his blood. And then we had the Aedes aegypti mosquito, which bit him, and then that started the whole process. So that's how it took off. The symptoms really, in about 85% of patients, they really don't have any symptoms whatsoever. You see patients, a smaller subset of patients, they say they had a little headache, a little blurry vision, a little rash, a little fatigue, and they just get better on their own. That's the vast portion. So even if you get bitten, you get the disease, the vast portion of people don't actually get this severe syndrome. So that's important to know.